starting with the most important one, which is malaria caused by Plasmodium. Now, if there is two main species, we have Vivax and Falciparum. If there is uncomplicated malaria, which is caused by Vivax or Falciparum. So if it is caused by Vivax, the drug of choice is chloroquine. CH means chloroquine. Chloroquine is the drug of choice for Plasmodium vivax malaria. Whereas chloroquine is ineffective in Falciparum in most cases. So for Falciparum malaria, drug of choice is ACT, Artemisinin based combination therapy. Artemisinin based combination therapy. मेरी वीडियो को ऊपर साइड ले लो. Is it interfering with any place? नहीं. तो फिर क्यों ऊपर लेना भाई? क्या करना चाह रहे हो? पढ़ाई कर लो, पढ़ाई का टाइम है, फालतू के काम मत करो अभी. ठीक है, चलो. सो कमिंग बैक, Vivax malaria drug of choice is chloroquine. Falciparum malaria drug of choice is artemisinin based combination therapy. Okay? Now, what is the main difference between Vivax and Falciparum? Two main differences between Vivax and Falciparum. Quick little clinical difference. Vivax and Falciparum में clinical difference क्या होते हैं? Vivax malaria is usually mild. Falciparum cause complicated malaria. Complications are caused by Falciparum. Severe malaria, cerebral malaria, all caused by Falciparum. Vivax is usually mild to moderate, not severe. But Vivax parasite, it can relapse. Vivax malaria, there is relapse because it contains hypnozoite, whereas Falciparum never relapses. Falciparum में hypnozoite नहीं होते, तो Falciparum do not relapse. Falciparum do not relapse. So uncomplicated malaria caused by Vivax, answer is chloroquine. Falciparum is ACT. But because there is relapse, we need to kill hypnozoites also. So in case of Vivax malaria, we need to give Primaquine. So chloroquine with Primaquine. Primaquine is to kill the hypnozoites to prevent relapse. Okay? Then if it is complicated malaria always answer is intravenous artesunate. It is the most effective drug. So IV artesunate is a drug of choice for complicated malaria. Okay? And killing the hypnozoite to prevent the relapse is called as radical cure. When the radical cure is done by Primaquine. And Primaquine is given for 14 days for radical cure. For radical cure, Primaquine is given for 14 days. So that is about treatment of malaria in a person who is not first trimester pregnancy. Everywhere else we will use this. Okay? Now if there is first trimester, the important thing to remember, two drugs are avoided in pregnancy. One is Primaquine. Primaquine is contraindicated in all the trimesters. Second is ACT is contraindicated in first trimester. We avoid ACT in first trimester. Clear? Rest everything will remain same. So chloroquine will remain same chloroquine. But Primaquine we will not add because Primaquine is contraindicated. ACT we will change to Quinine. Instead of ACT we will give Quinine. Q is Quinine. Yeah? IV artesunate will remain same everywhere because it is severe malaria. We are understanding, we are caring about mother more. Okay? Radical cure we will never do in pregnancy because only drug for radical cure is Primaquine and Primaquine is contraindicated in pregnancy. Okay. Now, if it is second or third trimester, everything else will remain same, just like without pregnancy. Only difference is because it is pregnancy, so we will not give Primaquine. Primaquine remove कर देंगे, second and third trimester, everything else will remain same. Is it clear? So let's quickly revise because this is important. एक बार बिना टेबल देखे try to answer the question because that is important. Clear? भाई सबटाइटल कैसे ऑफ करते हैं मुझे नहीं पता. सेटिंग्स सबटाइटल ऑफ कर देना यार. Now without looking at the table, try to answer because these are important. Okay? Drug of choice for Plasmodium vivax malaria is chloroquine plus Primaquine. Okay? But in pregnancy we will not give Primaquine. So first trimester, second trimester, third trimester it will be chloroquine only. Falciparum malaria drug of choice is ACT. But in first trimester we will give Quinine. Rest everywhere second and third में ACT ही रहेगा. ठीक है. Complicated malaria everywhere IV artesunate. Complicated malaria IV artesunate everywhere. Clear? And radical cure we use Primaquine for 14 days. Clear? So that is the treatment of malaria. Now quickly discuss what is ACT. ACT is artemisinin based combination therapy. Artemisinin based combination therapy. We have two type of ACT. One is Artesunate plus sulfatoxin pyrimethamine, and second is Artemether plus Lumefantrine. Now this ACT, Artesunate sulfatoxin pyrimethamine, it is given all over India. All over India. Whereas Artemether-Lumefantrine is used mainly in northeastern states because there the parasite is resistant to sulfatoxin pyrimethamine. So you can remember that from the mnemonic NEEL. Northeast state में Artemether plus Lumefantrine, Artemether plus Lumefantrine, बाकी सारे इंडिया में ASP, Artesunate plus sulfatoxin pyrimethamine. Everywhere else we have ASP, but in northeastern states we have Artemether plus Lumefantrine. Artemether plus Lumefantrine. नीला से याद कर लो, जैसा मर्जी याद कर लो, नीला. नीला is also good. Okay. Primaquine we already discussed. Primaquine is drug of choice for radical cure of Plasmodium vivax malaria. Radical cure of vivax malaria. Primaquine, apart from that, it can kill gametes of all species. Kill gametes of all species of Plasmodium. For radical cure, it is given for 14 days. Whereas for killing the gametes, single dose. One dose can kill the gametes, but for radical cure, it need to be given for 14 days. And what is important, you need to remember it is contraindicated in 3 special situations. Pregnancy, which trimester it is contraindicated? Which trimester? Pregnancy के कौन से trimester में? All trimesters. Contraindicated in all trimesters. Second, it is contraindicated in infants, that means less than 1 year old baby. And third, it is contraindicated in patient with G6PD deficiency. So 3 important contraindications of Primaquine need to be remembered. Radical cure of vivax, it is drug of choice, and it can also kill gametes of all these species. Okay, so that is about malaria. Done. Then moving to the most important disease, which is tuberculosis. Can you please give indications for prophylaxis? But a prophylaxis is given when a person is coming from the endemic area. अगर endemic area से आदमी आता है, endemic area में जाता है, sorry, तो we need to give prophylaxis, that is for travelers. Travelers में prophylaxis करते हैं. So prophylaxis, although have not been asked long time, prophylaxis, if the person plan to stay there for less than 6 weeks, or the person plan to stay there for more than 6 weeks. If the person plan for less than 6 weeks, we will use doxycycline. More than 6 weeks, we will use mefloquine for prophylaxis. That is for prophylaxis. Update on treatment malaria in pregnancy, safe in all trimesters, including first trimester, chloroquine, artesunate, quinine. Yes, Harshik tak it's all right, but still the treatment will remain same. We will use prefer chloroquine only. Artesunate is not preferred in first trimester unless it is a severe malaria. Severe malaria में prefer नहीं करते, हम prefer करते हैं. चलिए, coming to tuberculosis, first line drugs for TB. We all know first line drugs are HRZE and E. HRZE and E. And one of the second line drug is S. I hope I don't need to write the names of them. H is isoniazid, R is rifampicin, Z is pyrazinamide, E is ethambutol, S is streptomycin. So first of all, we'll make a table here only. Out of these, which drugs are cidal, which are static? Only static drug is ethambutol. Ethambutol is static. All other drugs are cidal. Isoniazid, rifampicin, pyrazinamide, streptomycin, all are cidal. Then second, which is effective against which type of bacteria? Remember, isoniazid, rifampicin, and ethambutol are effective against both intra and extracellular bacteria, whereas pyrazinamide is only for intracellular bacteria and streptomycin is only for extracellular bacteria. Then third, which is hepatotoxic? Which drug cause liver damage? Isoniazid, rifampicin are hepatotoxic. Pyrazinamide maximum hepatotoxic. But ethambutol and streptomycin do not cause liver damage. Ethambutol and streptomycin liver damage नहीं करता. Okay? And lastly, safety in pregnancy. Isoniazid is safe. Isoniazid rifampicin is safe. Ethambutol is safe. Pyrazinamide is avoided. यूजुअली कंसिडर्ड सेफ बट अवॉइड करते हैं फिर भी. स्ट्रेप्टोमाइसिन इज एब्सोल्युटली contraindicated in pregnancy. Contraindicated in pregnancy. And lastly, special points. What are the special points you need to remember? Isoniazid is one of the ship drugs. Ship drugs, I hope all of you remember. Ship drugs are for? Yes, all ship drugs are metabolized by acetylation, and ship drugs can cause SLE. They are metabolized by acetylation, they can cause SLE. Ship stand for sulfonamide, hydralazine, isoniazid, and procainamide. So these drugs, they are metabolized by acetylation and they can cause SLE. Acetylation and SLE. Clear? So ship drug, acetylation and SLE. Second, isoniazid can cause neuropathy, mostly peripheral neuropathy, but in overdose it can cause seizures also. So isoniazid can also cause seizures, and peripheral neuropathy and seizure occur due to deficiency of vitamin B6. Vitamin B6 deficiency lead to seizures and peripheral neuropathy. Seizures and peripheral neuropathy. Okay, hepatotoxicity तो हमने पढ़ लिया इधर. Now rifampicin, special point to remember, rifampicin is always given empty stomach. Rifampicin is always given empty stomach. Empty stomach देते हैं हमेशा. Second, rifampicin is a powerful enzyme inducer which can lead to lot of drug interaction. Enzyme inducer and lot of drug interactions are there. And lastly, rifampicin, it can also result in orange colored urine. Three main points to remember. Given empty stomach, enzyme inducer and orange colored urine. Pregnancy में कौन सा एंटी-टीबी ड्रग अवॉइड किया जाता है? आइसोनिल रिफैम्पिसिन, पैरासिटामोल, स्ट्रेप्टोमाइसिन. बेटा अवॉइड, अगर ये ऑप्शन में है तो स्ट्रेप्टोमाइसिन तो ऑब्वियसली आंसर होगा. इफ स्ट्रेप्टोमाइसिन इज नॉट इन द ऑप्शन देन मार्क पायरासिटामाइड. ठीक है, अगर स्ट्रेप्टोमाइसिन ऑप्शन में ना हो तो पायरासिटामाइड मार्क करते हैं. ओके, नाउ जेट पायरासिटामाइड, द मेन साइड इफेक्ट इज हाइपरयूरिसीमी. पायरासिटामाइड कॉज गाउट, हाइपरयूरिसीमी. पायरासिटामाइड कॉज गाउट. इथेम्ब्यूटॉल, ई फॉर आई प्रॉब्लम्स. It cause optic neuropathy leading to red-green color blindness. Optic neuropathy leading to red-green color blindness. Ethambutol optic neuropathy. And streptomycin is nephrotoxic and ototoxic. Streptomycin is nephro and ototoxic. Clear? So these are the important points regarding the first line drugs HRZE and S. Yes, ethambutol का characteristic side effect है optic neuropathy. E for eye problem. Now coming to second line drugs. Second line drugs पहले कर लेते हैं, फिर हम बाद में मैकेनिज्म्स पे चलेंगे. Second line anti-tubercular drugs. In second line drugs, you need to remember about some important points. First, second line drugs include some of the injections and fluoroquinolones. Injections like streptomycin, kanamycin, capreomycin, amikacin. And fluoroquinolones, oh my god, love wala. Okay, same fluoroquinolone. Ofloxacin, moxifloxacin, getifloxacin, levofloxacin. So this is second line drugs which are cidal. They kill the bacteria. Second line cidal drugs are injectable and fluoroquinolones. Then second line static drugs. These include cycloserine, ethionamide, and PAS, para-amino-salicylic acid. Cycloserine, ethionamide, and PAS. The important MCQ was cycloserine cause psychosis. We discussed psychoserine. Ethionamide, it cause, and both of them cause hypothyroidism. So which second line anti-tubercular drug cause hypothyroidism? The answer will be ethionamide or PAS. One drug which is not used nowadays is thioacetazone. Thioacetazone was used. Now it is rarely used, and even then it was contraindicated in patient with HIV. HIV के लोगों में पहले contraindicated थी. ठीक, अब तो देते नहीं है इसमें. Then we have some drugs, second line drugs which are used for other indications but now approved in TB. They are already available for other indications but now approved in TB. These include clofazimine and linezolid. Clofazimine cause skin pigmentation, brown pigmentation of skin plus dryness of skin. Just give the feeling that coffee is spilled on the skin. So when coffee is spilled on the skin, it become dry and it become brown colored. So brown colored pigmentation with dryness caused by chlorphasmin. Dryness is called as ichthyosis. Yes, the word used for dryness is ichthyosis. Then linezolid we already discussed cause peripheral neuropathy. Linezolid cause peripheral neuropathy as a side effect. Linezolid cause peripheral neuropathy as a side effect. Then moving to totally new drugs in tuberculosis. Totally new drugs in tuberculosis. These include bedaquiline, delamanide, and pretomanide. Bedaquiline, delamanide, pretomanide. These are totally new drugs in tuberculosis. So bedaquiline act by inhibiting mycobacterial ATP synthesis. तो बेसिकली बेटाकुलिन देने से बैक्टीरिया में एनर्जी नहीं बचेगी तो बेड पे लेट जाएगा. बेड पे लेटाने वाली दवाई इज बेटाकुलिन. देन डेलामिनाइड, प्रेटोमेनाइड, दे आर नेम सेइंग MAIN, so they are mycolic acid inhibitors. Mycolic acid inhibitors. Delamanide and pretomanide are mycolic acid inhibitors, and all the three drugs side effect is QT prolongation. All three drugs can cause QT prolongation in ECG. Clear? All three drugs cause QT prolongation. Okay. Now coming to treatment of T. So first of all, mechanism of isoniazid rifampicin. Isoniazid is metabolized to form activated compound. Isoniazid is inactive. So first of all, it is activated. And this is activated by an enzyme called as catalase peroxidase. Catalase peroxidase enzyme is present in the bacteria which will activate it, and the gene which form this enzyme is KatG. Now when it is activated, it will inhibit the mycolic acid synthesis. Inhibit the mycolic acid synthesis. So question asked, which mutation cause isoniazid resistance? It is KatG. KatG mutation cause isoniazid resistance. Then rifampicin, it acts by inhibiting RNA polymerase. And this is formed by a gene called as rpoB. So if there is a mutation in rpoB, it causes rifampicin resistance. So rifampicin resistance is due to mutation of rpoB gene, whereas isoniazid resistance occurs due to mutation in KatG gene. KatG mutation. Okay. So that is about mechanisms of isoniazid and rifampicin. Now quickly moving to, yes, INHA, but that is less common, beta, Tanuj. Now coming to treatment of tuberculosis. Treatment of tuberculosis in every patient now is 2-HRZE plus 4-HRE. 2-HRZE plus 4-HRE. Now some of you will be saying the new treatment guidelines have come. They are just the new guidelines, but still the drug of choice is same. ठीक है, अगर ट्रीटमेंट ऑफ चॉइस पूछे तो यही है, द न्यू इज अल्टरनेटिव 4 month स्ट्रेटेजी. ठीक है, ये तो 6 महीने की हो गई. सो न्यू ट्रीटमेंट गाइडलाइंस आर फॉर 4 months, बट दे आर नॉट द ड्रग ऑफ चॉइस. द ड्रग ऑफ चॉइस इज स्टिल दिस 2-HRZE plus 4-HR. 2-HRZE plus 4-HR ही मार्क करना है आप कहीं भी है. नाउ ड्रग रेजिस्टेंट टीबी, यू नीड टू रिमेंबर विच व्हेन वी विल से मल्टी ड्रग रेजिस्टेंट टीबी, when we say pre-XDR and when we say XDR. That is important. Classification is important. MDR TB when it is resistant to H plus R, isoniazid and rifampicin. Pre-XDR is when is H plus R plus fluoroquinolones. And when it is resistant to H plus R plus fluoroquinolone, that means pre-XDR plus resistance to any one of bedaquiline or linezolide, then we say it is XDR. Bedaquiline or linezolide, any one of the two, then it is called as XDR. So you need to remember this definition, because on drug resistant TB mainly question asked is on definition. Definition में पूछते. Okay? Pregnancy में भी same है बेटा. Okay? So some people still use the older regime, but guidelines say same treatment. Is it clear? Okay. आफ्टर इंटेंसिव फेज यूजुअली वी स्टॉप पैराजिनामाइड. पैराजिनामाइड को बंद कर देते हैं. तो HRZE है ना, 2 महीने का इंटेंसिव फेज है, उसका जेड नहीं है तो पैराजिनामाइड को बंद कर दें. ओके, चलिए. नाउ कमिंग टू इंपॉर्टेंट साइड इफेक्ट्स ऑफ एंटीट्यूबरकुलर ड्रग्स. एक्सटेंसिव में क्या डिफरेंस होगा बेटा? एक्सटेंसिव यही तो है. XDR इज एक्सटेंसिव ड्रग रेजिस्टेंट. चलिए. Non-tubercular use of rifampicin has plenty of users but not used. Rifampicin is effective against gram-positive also, gram-negative also. Rifampicin is effective against MRSA, effective against Pseudomonas, effective against Brucella. Plenty of organisms it is effective, but we normally do not use it. Okay, chalo. Now coming to ATR, adverse effect. Isoniazid, two important side effects. One, it is hepatotoxic. Second, it causes pyridoxine deficiency, which can lead to peripheral neuropathy or seizures. Rifampicin, the main side effect is hepatotoxicity and orange colored urine. Orange colored urine. Pyrazinamide cause hyperuricemia apart from hepatotoxicity. Ethambutol E for eye problems. Optic neuropathy leading to red-green color blindness. Red-green color blindness. Streptomycin is nephrotoxic, ototoxic, and cause neuromuscular blockade. Ethionamide cause hypothyroidism. All three cause QT prolongation. QT prolongation. Clear? So these are the important adverse effect of anti-tubercular drugs. Okay. Just linezolide add कर लो peripheral neuropathy. Linezolide peripheral neuropathy. Peripheral neuropathy.